Hello, I'm Dr. Nan Nussel of Beatdown Burnout. And in the early 2000s, I hit a wall. I was working a traditional pediatrics job in a large multidisciplinary clinic, and pediatrics was the only department that was having clinic hours 7 days a week. That meant that I was working 90 to 110 hours a week, just like residency. My husband was applying for disability, and there were a number of things he could not do around the house. I had two school-aged children, and they were both struggling in school. I felt like I was failing my family. Meanwhile, in the clinic, I had a caseload that was over 2,400 patients, 35% of whom were public aid. In a private clinic setting where most of the pediatricians carried less than 20% public aid. And I didn't choose to have 35%. It was a clerical error that went on for months before it was caught and then never actually got resolved. Physicians outside the Department of Pediatrics, most of them only carried about 10% public aid. They considered it tithing. So when the board of directors looked at my numbers, they felt that I wasn't carrying my weight. I wasn't bringing my share of income into the clinic. I was failing them, and they made sure to let me know about that. They had their ways. Over the years, more and more responsibilities fell onto the Department of Pediatrics, and I lobbied against that. And soon found myself chairman of the department. I thought this was a great opportunity for me to become a champion for my colleagues, for me to be a real voice for them. Until three members of the board of directors came in to my office. Two of them sat down in the chairs that were available, and the third one stood. And they made it clear in no uncertain terms that my function was to be a unilateral mouthpiece for the board of directors and not carry concerns from my department back up to them. There was to be no dialogue. I was to be a mouthpiece for the board, nothing more. They weren't interested in our needs. It was not a very good day. Then one day I was driving home from the hospital. I had worked 36 hours straight. I don't remember if I'd gotten more than 2 or 3 hours sleep that night, but I had worked 36 hours straight. And then I had to go back to the hospital and round on my patients there. And as I was driving home from the hospital, I stopped at a four-way stop and I waited for the stop sign to turn green. Not a traffic light, a stop sign. And I didn't even realize the absurdity of the situation until the pickup truck behind me started honking. I made it safely home the next few blocks and immediately put myself to bed. I got up for dinner, stayed awake for about another hour, and then went back to bed and slept through the night. And I knew it was more than exhaustion, so the next day I made a point of going to the CMO's office. And I told him all the things that were happening in my life. And I said, I think I'm burnt out. What are you going to do about that? Was his immediate response without skipping a beat. He didn't offer any time off. He didn't offer any counseling. Nothing. No suggestions. He put the responsibility back on me. As I drove home that evening, I thought about that. This was the same physician who would call me for procedures an hour before my call shift would start. And I would remind him, I'm not on call yet. He would say, yes, but you're here. Like, yes, that is part of my time management to get through the workload that I have to get through before I go to clinic in the morning. But you're here. Yes, but you didn't schedule this procedure with the clinic so that I can start an hour late in clinic. Well, you should consider this a compliment that I trust you enough to have you do this procedure. I'm like, no, this was bullying. This was his way of throwing his weight around. Just like the board of directors was throwing their weight around with their unilateral form of communication and telling me how to run my department instead of listening to our needs, instead of listening and caring about any systems improvements we might need to take better care of our patients. "95% of those procedures could have waited until I was actually on call. And the policy was for him to notify the clinic so that they could block out extra time for that procedure before scheduling patients on my schedule that day. He wasn't interested in that. You see, we had no resources for burnout. And we weren't corporate, we were physician owned, and we were eating our own. Yes, physicians eat their own. We hear about this all the time with nurses, about nurses doing this. And physicians are often the first to point their fingers at it. However, physicians do it as well. This is the bullying that I've spoken of so many times. Often the recipient is female or a person of color, and it gets swept under the rug and called the politics of medicine. It is a huge, huge driver of burnout, and there are no real resources for this for most providers. In the early 2000s, my CMO asked me what I was going to do about it. He washed his hands of the whole thing and then put the responsibility squarely on my shoulders. Many people told me I should have quit on the spot. I found out shortly after that he had just received devastating news about his own health. So I cut him some slack. I didn't quit right away, but I did start looking for an exit strategy. And when the next CMO, his replacement, did something similar, I tendered my resignation. Now, that was my first experience with burnout. Burnout can be a chronic, recurrent disorder. And those of you who've suffered burnout need to be aware of this. And you need to watch for the signs of when it comes back so that you can get help right away the second time or the third time. Because most people that first time let it go on for many, many months before they reach out for help. Don't let that happen when it recurs. After leaving that clinic, I had the opportunity to work in several different scenarios. I've been a professional locum for over 10 years now, and I have loved it. I have worked in some really phenomenal places. I've had some incredible experiences. Some places that I've actually loved working, places that I've been invited back to, and it's been incredible. But that has not protected me from being in places where the workload has been overwhelming. That has not protected me from being in places where the administration took advantage of docs whose work status was locums. And over again, almost everywhere I went, I heard, that's just the politics of medicine. I saw colleagues being bullied for the color of their skin, their gender, their sexual preferences. And when I would go and ask about help for them, when I would ask about burnout prevention, mental health, or any kind of support for them, I would get odd looks or really uncomfortable questions. There were no real resources for burnout prevention or burnout treatment, and absolutely nothing for bullying. And even if you're told there will be no retaliation, there always was. Let's fast forward to today. We've made a lot of progress in the last couple of years. Or have we? The AMA came out with a statement in 2021 that bullying in healthcare actually exists. They came out in support of programs for prevention of bullying and burnout. However, those programs were very limited in scope. They relied heavily on mindfulness. At that time, it was already known that mindfulness only affects 20% of the drivers of burnout. There's absolutely no data that it helps bullying at all. So only 20% of the drivers of burnout. The other 80% requires organizational change. And yet, many organizations went ahead and instituted these mindfulness programs. Why? It's believed that they did so because it was their belief and their mindset that organizational change is difficult and expensive. Their mindset. What did we learn from this? We learned that mindfulness programs, when applied to people who aren't ready and aren't looking for mindfulness, can cause more harm than good. They can actually make burnout worse. Therefore, it is not a real resource for burnout unless you're actually looking for mindfulness. Now, most people who are already looking for mindfulness programs have already found such a program. They don't need one to be rolled out by their employer. Offered by their employer is different from being rolled out and mandated by your employer. Yet rolled out and mandated by your employer is what we most often saw. What programs we're not offering and what many healthcare staff are requesting are effective ways to communicate with administration and break down barriers. They're requesting ways to set up systems that allow physicians and other staff to voice their concerns and negotiate for their needs without fear of retaliation. Physicians and nurses are seeking a comprehensive plan for their teams to set boundaries in terms of hours and duties to prevent moral injury. They're asking for a system that ensures that narcissistic leaders are required to take courses on emotional intelligence and their progress monitored, or that they be replaced based upon staff satisfaction reports. Leadership can no longer be based upon the financial bottom line, or you will never have decent staff retention. If you can't retain staff, then there's no way you're going to be able to retain a patient customer base. Now, what I'm outlining here is not pie in the sky. It's a structured plan of effective communication that is easily attainable and implementable. I know so. I've seen it and I've done it. In other words, it's a real resource for burnout. What is it that we do? We make people matter. So contact me for more information for your team and jump on this opportunity before you lose more staff. I'm Dr. Nan Nessel of Beat Down Burnout.